We've been called out to a scene. A lady has just had a fall. She's got a laceration on her arm and a possible fracture. Approaching the scene, we can see there's no dangers. There's a nice entrance and exit for the ambulance and all the crew. Beth, are you happy to go in?
Yes.
Yep. Okay. Hi, my name's Tyler. This is Beth. We're here to help. What's happened? You just...
So I was just in the back garden on a ladder, and I just misplaced my stepping and fell backwards off it.
Okay, I can see you've got quite a laceration here. Are we okay just to bandage that?
Yeah.
Okay, Beth, if you could just elevate that and apply pressure, we'll start to bandage it. And what's your pain scale like at the moment?
At the moment, I'll give it an 8.
Okay. I can see that her GCS is about 15. She's got nice clear airways. She's breathing fine, responding nicely. So yeah, GCS of 15. It's still bleeding a bit, so I'm going to apply another bandage for you, and this time we'll twist it to apply more pressure. I'll just check her pulse just to make sure it's not cutting the circulation off. Okay, so I can still feel a pulse, so that's good. It is still bleeding, so I'm going to apply a tourniquet. I'm just going to let the patient know that it's quite painful. So this here is just a tourniquet. We're just going to cut off the circulation so the blood stops. It's a bit painful because it's quite tight on your arm, but we'll get you some painkiller soon for that. With a tourniquet, we just want to tighten it. We'll just put it 10 centimeters above the laceration. We'll also twist this part here about twice or 2.5 times just so it's nice and tight. We'll also time it when we put it on so that the hospital knows when we placed it, and we won't take it off at all. The hospital will do that for you. Okay, so I'm just going to do a trauma sweep. Oh, I'll check your pulse again. So yeah, it's a bit faint now, which means that it's cutting off the circulation, so that's good. I'm just going to do a trauma sweep. Am I okay just to feel around? Okay. So yeah, Beth, if you just keep it elevated, I'll just check her head, her face, all that stuff. It feels good. Her neck, is there any neck pain at all?
Yeah, my neck feels a bit tender.
Okay, we'll get that done. Check your arm, check your chest and the abdomen. I also check for blood in my gloves. There's nothing. Checking the back. And no pain at all?
My left ankle hurts.
So just this ankle here and your neck?
Yeah.
Check the hips as well. Okay, so because she's got a sore neck, we'll just apply a neck brace. Beth, if you could just elevate her neck. I'll just level it up, so just using my fingers, I'll measure between the top of her shoulder and bottom of her chin. For me, it's about 3 fingers, so that makes it about short. And yeah, Beth, if you could just hold that. So I'm just going to slide this under your head. Okay, so now that's done, I'll check her vitals. So I'll check her heart rate, her respiratory rate, her lungs, and also her blood pressure. Yeah, Beth, if you just want to keep her neck or just watch over her neck just so it's nice and stable. So first I'll check your heart rate. Am I alright to check your pulse? So I'll check for 15 seconds. Okay, so that brings her heart rate up to about 108, which is above normal. Normal is about 50 to 100. I'll keep holding her wrist as if I'm checking her pulse, but I'll check her respiratory rate just so she doesn't subconsciously change her breathing. Again for 15 seconds. Okay, her breathing's about 24 per minute. That's again above the normal. It's usually about 12 to 20 respiratory rates per minute. So I'm just going to check her blood pressure now. So I'll just put this around here. So blood pressure is about 100/70. The normal one is usually around 120/80. So again, that's a bit low. So doing her blood pressure, I'm just going to check her breathing. So for the sake of the videos, she's got a shirt on, but normally we would expose the chest area and listen to her breathing. So Kate, if you could just take some deep breaths in for me. So her lungs sound nice and clear, there's no crackles or anything, it's just nice clear airways. Okay, I'll ask again, what's your pain scale like at the moment?
So it's still an 8 right
An
now.
8 out of 10? Okay, so in my opinion it would give methoxyfluorine. I have to ask clinical, so I'll just give clinical a call. So clinical, I have a patient here, she's got a laceration on her left arm and a possible fractured ankle. Her pain's 8 out of 10, her heart rate's 108, respiratory rate 24, blood pressure 100/70. Am I able to give methoxyfluorine? And hopefully they'll approve. I'll just check the drug, so I'll check the date, make sure it's not expired. I'll check the right dosage, which is 3 mils. I'll check that it's all nice and clear so it doesn't look like it's been tampered with. I'll also get my outsider check, so Beth, if you could check the drug. And while she's doing that, Kate, I'll just ask you a few questions. Are you allergic to any medication at all?
No.
Have you had methoxyfluorine in the last week?
No.
Do you have history of malignant hyperthermia?
No.
Do you have history of renal impairment?
No.
Okay, and you're able to obey commands?
Yeah.
And sure you've got no allergies?
Yeah.
Okay.
Yep, so the drug is methoxyfluorine, it's 3 mils and it's 2019.
Okay, sweet. So with this drug, you just have to take little breaths through this whistle here, and then make sure you breathe out into the whistle as well. So that should take your pain away nice and quickly. With the methoxyfluorine, Kate, you might feel a bit nauseous and you might have a headache, and it does taste a bit bad, but it will take your pain away.
Okay.
Okay? Sweet, and we'll move down to the ankle. So we move down to the ankle just to assess her fracture. I'm going to start off using the acronym PLUSTIS, so just checking pain and all that kind of stuff. I'm just going to expose her ankle, so am I right just to lift your ends of your trousers up? Cool, so I can clearly see that the left ankle is a lot more deformed than the right ankle. The temperature is a bit different, so this ankle is quite cold and this one's a lot more warm. I'll just check your cap refill. So on her nice normal ankle, she's fine, and then this one here is just a bit slow. If you could just wiggle your toes for me, Kate. Okay, so this one, yeah, is a bit deformed and not a lot of movement, but this one here is quite good. And can you feel this?
Yeah.
Same on both sides?
Yeah.
And this as well?
Yeah.
Okay, cool. I'll just check your pulse as well. So on the unaffected ankle, it's quite strong. This one here is a bit weak. Okay, so we'll just straighten it up using a splint. So what's your pain scale like as well?
It's come down to about a 6 now.
Okay, so the methoxyfluorine is working. Beth, if you could just elevate her ankle while I slide this under. And I'll just bandage it as well to give it more support, so if you could just lift it up. I'll just do another one closer to the knee so it gives it more support. So we've straightened it out more, and I can already see that the colour is coming back a little bit. I'll just check the cap refill again. So yeah, it's a little bit better. And could you wiggle your toes for me again, Kate? Yeah, so the movement is getting slightly better. I'll just check the pulse as well. Pulse is coming back a bit more stronger, and temperature is rising just slightly. So we'll just scoop her up, pop her on the stretcher and take her to hospital, where they'll assess everything and get her